Now let's go to the second part of the discussion. Electrical stimulation for denervated muscle. No? So, in-add ko na to kasi maikli lang yung discussion natin with your EMS. No? So, please bear with me. Alright? So, stimulating denervated muscle, no? It maintain it in as healthy state as possible while waiting for the innervation. That is the purpose of stimulating the denervated muscle. No, the features, no, innervated versus your denervated muscle. So, in using ES, you substitute for the physiological muscle contraction. No, you prevent negative changes, especially your atrophy. No, maintain muscle integrity and remain functional. No, so the highest goal to denervated muscle is from retard atrophy to maintain muscle integrity. Now, we would want kasi na while waiting for the re-innervation, we would want to once na nagkaroon na siya natapos na yung re-innervation niya, madali na lang sana i-strengthen yung muscle, no? Versus yung kailangan pa nung body mag-form ulit ng muscle tissues. No? That would take time pa. So, in here, stimulating the denervated muscle, yun nga, ang goal natin dito is to maintain the muscle integrity. Okay? Highest goal to innervated muscle naman, no, is to reach near normal or to normal function. Okay? So, kapag naman innervated ang muscle ninyo, no, we can make use of the EMS to reach near normal to normal function. Although, ito, no, kapag ka-innervated naman ang muscle, okay, innervated ang muscle, it's most likely if kapag hindi magalaw ni patient, no, siguro masyadong painful, or siguro there is a blockage, no, so usually yan, gagamitin natin yung ES. So, parang in a way, it appears as if denervated muscle siya, pero hindi talaga. So, kaya nga, this shows the importance of electrodiagnosis. Okay? So, what happens to denervated muscle before the innervation? No? Consequences of interrupted peripheral neural arc. No? Of course, there is loss of voluntary activity, loss of reflex response. So, kapag nag-test kayo for TTRs, no, there is a loss of reflex response or hyporeflexic siya. Progressive muscular atrophy, weeks or months. So, it depends on how long was the patient not able to move that certain body part. Okay? So, yan. Those are the 3 consequences of your interrupted peripheral neural arc. Okay? So, denervated muscle, this is the paralysis and wasting of a muscle to a greater extent. And usually, it fibrillates, no? Fibrillates because there is a marked hypersensitivity to your acetylcholine. No? Kaya nga, di ba, sa electrodiagnosis natin, the Rio base of your denervated muscle, around 10 to 20 days after, no, it lowers because of the hypersensitivity. They have different chronoxy level and strength duration relationship. And it has sluggish contraction using the long duration current. Okay. Atrophy. No? Pag sinabi naman nating muscle atrophy, this is the shrunken, wasted muscle. So, maliit na siya. Okay. Ayan. Etiology, no? It could be caused by a lot of factors, no? But it will go down to depend on the types of the atrophy. No? So we have 3 types, no? Your physiologic atrophy, your pathologic atrophy, and then your neurogenic atrophy, no? So first off would be the physiologic atrophy. This is when ito yung madalas nyong mababasa in different references as disuse atrophy, no? Or hindi nyo siya masyadong ginagamit kaya siya nag-atrophy. Okay? Hindi siya nagagalaw. Or yung load na kinikarry niya before, hindi na ganun kabigat ngayon. So, nag-atrophy siya. So, lumiit siya. Alright? Next would be the pathologic atrophy. No, it means that the atrophy was caused by aging, certain diseases, no? And then the most severe would be the neurogenic atrophy. This is usually caused by injury directly to the nerves itself, no? Causing that, syempre, we would have the neuromuscular complex, as discussed before. Your neuromuscular complex, when affected, no, hindi makakapag-function si muscle without the action potential transmission signals of your nerve. Okay? So, yun siya. Investigation, no, quantitative methodology, macroscopic technique, weighing a denervated muscle and comparing it to the contralateral. No? Pag microscopic technique naman, no, usually ito yung ginagamit natin, no? Kung paano natin i-quantify yung atrophy, no? Macroscopic technique. No, usually, we make use of the muscle bulk measurement. So, matututunan niya siya. I think it's part of your TheraX next year. So, paano mag-measure ng muscle bulk. And then, microscopic technique, measuring diameters or areas of denervated muscle fibers and contrasting values to the contralateral limb. Ito naman sa cellular level. Ito hindi na ito yung part kung saan pwede natin siyang ma-assess. No? But basically, in microscopic technique, you are measuring the diameter of the muscle fiber itself. Pag macroscopic naman, ito yung mismong yung muscle na itself. Okay? Yung sa microscopic muscle fibers. Sunderland review of muscle atrophy. No? Your atrophy, no, may have rapid initial loss of weight, especially yung muscle natin, it accounts to majority of our weight, no? Yan. So, if 29 days na daw na hindi nagagalaw ni patient, muscle is sustaining 30% loss. Okay? 60 days, increase to 50 to 60% muscle loss. And 120 days, the process is slowed. There is a much more stable state. And weight loss is between 60 to 80%. So, mas malaki. Now, generally, marked loss of weight could happen within the first 2 months. And then, mag-stable siya. Kasi halos wala ka ng malulos by the time na mag-reach ka na ng 120 days. Okay? So, pakitandaan ito. Especially to our patients who are deconditioned, no? Ma-observe nyo to. Talagang meron silang yung muscle loss, makita nyo, sobrang rapid siya. No? Especially within the first 2 months. Okay, in your atrophy, no, microscopically, type 2 fibers atrophy to a greater extent than type 1 muscle fibers. So, mauuna yung mga type 2 muscles, no, mag-atrophy kaysa sa type 1 muscle fibers, no. Kung maalala ninyo, your type 1 muscle fibers, mostly ito yung mga postural muscles natin. While your type 2 muscle fibers, na ito yung mga for mga fast type activities, no? Sila yung mga muscles na ginagamit, no? Like for sprinting, okay, yung mga yun. Next, no? Fibrosis. No? Lastly will be fibrosis. The percentage decrease of muscle fiber circumference, which would then be in loss in muscle weight. Okay? Reduction in fiber caliber, relative increase in connective tissue, no? Ito yung tatandaan ninyo, no? Reduction in fiber caliber, relative increase in connective tissue. When we say fibrosis kasi, nababawasan yung percentage of the muscle fiber itself, but the body will try to compensate it, no? Mapapalitan siya ng connective tissue. Kaya in cases of fibrosis, okay, ito yung kung saan as much as the body would want to compensate for the loss, no, yung fibrosis na to, tumitigas siya. Okay? So, kapag narinig niyo yung fibrosis, ito yung tumitigas yung isang area. no? Kasi the body would want to regenerate, pero hindi niya ma-regenerate yung tamang structure. So there is an increase in connective tissue causing that it is hard to move. It is somehow parang may contracture siya, pero at a lesser degree. Yun siya. The difference between the weight loss and the reduction in fiber caliber is accounted for by the relative increase in the amount of connective tissue, which compensates for the greater atrophy of the fiber. No, ito different case naman, no. I would like to give an example, no, yung fibrosis. There was this kaibigan nung dad ko, habang nagba-basketball daw siya, yun nga, to cut it short, nagkaroon siya ng rupture of the Achilles tendon. No? Mayaman naman, no? Meron siyang pang-surgery, no? Kailangan kasi i-surgery yun kasi that's Achilles tendon. So, nagkaroon siya ng rupture, but dahil ayaw niyang magpa-surgery, no? Tapos may nakausap siya. I'm not saying na itong brand na to wag gagamitin or whatsoever, pero in the case of this patient, he clearly needs the surgery. But instead of going for surgery, no, may nakausap siya na, eto, if you take this supplement, mas mapapabilis yung healing. Okay? Mapapabilis daw yung healing and everything. But then what happened was, hindi na siya nagpa-surgery. Actually, nag-testify pa nga siya na, ay tama, no, i-take ko itong Usana na ito, ganyan. Tapos, okay na, hindi na ako kailangan mag-surgery. But what happened to his tendon was it had a fibrosis. Yung gait, kapag inanalyze mo yung gait niya, it's as if hindi niya ma-dorsiflex ng maayos yung foot niya. Okay, umabot sa ganun. And to the time, hindi na siya nagbabasketball masyado. No? Parang somehow, naapektuhan yung mismong participation niya to those kind of activities. Right? So, yun yung fibrosis, no? It could compensate for the loss of a structure in our body, but the exchange would be it is somehow tighter in a way, no? Yung kung ano man yun, and it would really affect the range of motion of that certain body part. Okay? Basically, we wouldn't want to happen yung itong fibrosis nito because it adds a pain and it adds a problem in our already suffering muscle. No? So, steps must be taken to maintain muscle integrity. Na dapat you should limit the edema and stasis and maintain the flexibility of the part. No? Avoid further injury to the muscles as much as possible. So, yun yung when we say maintain muscle integrity. Kaya that's why we perform PROM exercises, no, hanggang sa po pwede nang magalaw ni patient para yung flexibility, ma-maintain natin siya. Hindi masyado magta-tighten yung muscle. And also limit the edema and yung stasis. Okay? Ililimit natin siya. O yung blood flow, dapat okay pa din around the area. No? When you don't move it kasi, no, the blood flow is kind of slow in that area. Okay, basically because there's no muscle pumping. Okay, so yun yung mga i-address natin. Fibrillation, this is spontaneous uncoordinated contractions of individual muscle fibers, and it's as if there is a persistent fine rippling of the surface of an exposed denervated muscle. So, wala kasi akong mapakitang video, but you could search for it. No, yung kung ano itsura ng fibrillation, pero this is definitely the best description that I could give you, okay, of the fibrillation. Other changes with denervation, no, acetylcholine hypersensitivity. Now, the law of denervation hypersensitivity, after a period of time, a denervated structure, which could be skeletal muscle, smooth muscle, or the gland, becomes hypersensitive to agents that normally activate it. No? So, ito yung reason behind, no? Kaya yung rheobase natin bumababa. Acetylcholine receptors, which are normally present only in the end plate region of the sarcolemma, okay, here, and becomes incorporated into the entire length of the fibers membrane. Okay? So, dumadami yung acetylcholine receptors natin. Kaya siya nagiging hypersensitive. Okay? Ayan. Membrane changes. No? The resting membrane potential of denervated muscle also falls. Okay? Ibig sabihin, no, mas madali siyang mag-contract. Okay? Transmembrane resistance increases. Denervated end plate membrane develops pacemaker characteristics wherein they rhythmically produce acetylcholine at their own regulation rate. So, kaya tayo nagkakaroon ng spontaneous fibrillation. Next would be the electrical and mechanical changes, no? Short duration electrical pulses would have no muscle response. Okay, and long duration pulse currents of greater than 10 milliseconds with a low frequency stimuli, no, would definitely have a muscle response wherein magko-contract siya sluggishly, no? Greater than 10 milliseconds lang naman. Alright, kung maalala ninyo in our electrodiagnosis, no, usually 1000 ms ang kailangan for it to have a strong muscle contraction. No, ito kasi 10 milliseconds only, no, so diyan contract sluggishly. So changes in Cronach C and SD curve, again, pag Cronach C magi-increase. Rio base, it will fall, no? The value would fall. So therefore in your SD curve magre-reflect 'yon. So as the pulse duration is shortened, higher current amplitude current will be needed to achieve the same strength of contraction produced by a longer pulse duration. Okay? So, ito yung magiging compensation, no? Itong pulse duration na to, again, dependent to upon the Cronach C. Okay? Kapag ang Cronach C mo is mataas, alright? Therefore, ang short pulse duration is not enough to produce a contraction. Therefore, you would have to compensate that. Saan? Saan mo babawiin? It would definitely be in your current amplitude. Okay? Kaya nagiging higher ang current amplitude. Therefore, if you would have a longer pulse duration, alright? If you would have longer pulse duration, then you might have a lesser current amplitude applied. Okay? Yan siya. So, EMS in denervation facts, no? Again, no, your ES it can only retard the muscle atrophy, but we cannot prevent the atrophy itself. So, over time, no, if hindi nagagawang maggalaw talaga ni patient yung body part, liliit at liliit talaga siya. Right? Only superficial fibers were activated by the stimulation. No? Yun yung isa sa mga reason kung bakit ang muscle atrophy nangyayari pa din. Alright? Kasi yung superficial fibers lang ang kaya nating i-activate by stimulation. Number of contractions per day was insufficient. No? Isa to sa reason. No? When you apply ES, hindi mo naman siya ina-apply 24/7. No? Now, kung isipin ninyo, in a normal person, no, ginagalaw niya yan throughout the day. Unless matulog na siya. Pero yung ES ninyo is applied for how many minutes lang, no? About 10 to 30 minutes. No? Around mga ganon. Depende sa kung ano yung goal or approach ninyo. Okay? And then the rest of the day, hindi na siya ma-activate. Kaya talagang liliit at liliit yung muscle. And change in muscle, no? It's not simply as an inactivity. Change in muscle is not simply as an inactivity atrophy. No? Nagkakaroon ng changes, of course, with the integrity of the muscle itself. No? Especially yung mga we call it mga electrolytes, and then yung condition of the cells within, no? Nagkakaroon ng change dahil hindi siya nagagamit. Okay? And so, parameter and effects. Alright? So, for EMS, we make use of the monophasic pulses. The intensity should be strong enough to produce vigorous muscle contraction or yung parang mabilis siya na pag-produce ng contraction. No? Kumbaga parang nag-fibrillate. Dapat ganun yung amplitude niya. Okay? Typically, it's a 20-minute treatment producing 500 to 600 single contractions. In here, no, sa lab ninyo, no, I will be guiding you kung ano yung magiging parameter dito. But definitely, paki-take note kasi hindi ko na lagay yung pulse duration. We make use of 1 Hertz or 1 PPS for the pulse frequency, while pulse duration is 300 microseconds. No? 300 microseconds. Okay? So with this one daw, no, at least if you apply ES for 20 minutes daily, at least you could prevent contracture formation and significant less atrophy. Okay? So ano yung effects if we apply EMS? You delay or diminish the atrophy that's given. Muscle fiber are larger. Connective tissue is less in treated muscle. Ibig sabihin, yung rate of our fibrosis is lesser. No? Kasi we wouldn't want fibrosis. Rate of re-innervation is increased. No? So, ibig sabihin, mas nakakatulong siya para mag-regenerate yung ma-hasten yung re-innervation natin. Okay? So, therefore, no, pagka ang rate of re-innervation is na-increase, mas mabilis babalik yung reflex or voluntary function. Okay? With the contraindications and precautions, the usual po, katulad na nabanggit natin kanina sa previous lecture. Okay? Yan. So, EMS, no, biphasic waveform with a 120 to 150 millisecond pulse duration. This is for individuals with complete lower motor neuron denervation due to cauda equina injury. This is according to a certain study. Ito daw yung ginamit nila. Okay, biphasic waveform with a 120 to 150 millisecond. Okay, electrode placement, no? Area where electrical stimulus will produce the greatest contraction with the least amount of electricity. Meaning, in other words, you place the electrode at the motor point. Okay, motor point. Patient positioning, no? Limb can be secured to prevent motion through the range, allowing isometric contraction at mid-range, secured by means of barrier or weighted cuffs. No? Isometric contraction lang yung kailangan natin. Hindi natin kailangan na pag na-activate siya, talagang gagalaw yung limb. Okay? Ayan. So, that would be the end of the second part of our lecture. No? So, kaya ako siya sinama na. You'll have your post-quiz, no? 20 items, no? Para naman sulit, no? yung inyong long lecture today. Alright? So, that would be the end for today. Thank you. Please don't forget your post-quiz mamaya. Okay?